Which of the following actions should a CCMA take when preparing a blood specimen for transport to an outside laboratory? A. Centrifuge the specimen after labeling the tube. B. Store the specimen in a refrigerator at 0 degrees Celsius. C. Ensure the specimen is placed in a biohazard bag with a completed requisition form. D. Label the specimen with patient initials only. Answer: C. Proper specimen transport requires placing the labeled specimen in a biohazard bag along with the completed requisition form to ensure safety and proper identification. A patient has a blood pressure of 180/110 mmHg. What action should the CCMA take? A. Report the finding to the provider immediately. B. Instruct the patient to increase fluid intake. C. Schedule a follow-up in 2 weeks. D. Repeat the measurement in 30 minutes. Answer: A. A blood pressure reading of 180/110 mmHg is considered hypertensive crisis and must be reported to the provider without delay. Which of the following is a CLIA waived test typically performed by a CCMA in a POL, physician's office laboratory? A. ESR, erythrocyte sedimentation rate. B. Blood culture. C. Rapid strep test. D. CBC, complete blood count. Answer: C. CLIA waived tests are simple and have a low risk for an incorrect result. The rapid strep test is a common waived test used to detect streptococcal infection. A CCMA is reinforcing teaching with a patient who is wearing a Holter monitor. Which of the following statements indicates understanding? A. I can shower while wearing the monitor. B. I will record any symptoms I have while wearing the monitor. C. I will take off the monitor during sleep. D. I should avoid all physical activity. Answer: B. The patient should record any symptoms, activities, and times during monitoring to correlate with the Holter data. Which of the following routes of administration will result in the most rapid absorption of a medication? A. Subcutaneous. B. Oral. C. Intramuscular. D. Intravenous. Answer: D. Intravenous administration delivers medication directly into the bloodstream, resulting in the fastest absorption. What is the correct angle of insertion for an intramuscular injection in an adult? A. 15 degrees. B. 25 degrees. C. 45 degrees. D. 90 degrees. Answer: D. Intramuscular injections are administered at a 90 degrees angle to ensure the medication reaches deep into the muscle tissue. Which of the following findings should a CCMA recognize as a manifestation of anaphylaxis? A. Hypertension and bradycardia. B. Dyspnea and hypotension. C. Abdominal cramps and vomiting. D. Rhinorrhea and cough. Answer: B. Anaphylaxis is a life-threatening allergic reaction characterized by airway constriction, dyspnea, and low blood pressure, hypotension. A CCMA is caring for a patient who reports sudden, severe chest pain and shortness of breath. What should be the CCMA's first action? A. Administer nitroglycerin. B. Check the patient's blood sugar. C. Activate emergency medical services. D. Call the patient's emergency contact. Answer: C. Sudden chest pain with shortness of breath may indicate myocardial infarction. The CCMA should activate EMS immediately. Which of the following would require a chain of custody form? A. Fecal occult blood test. B. Drug screening. C. Urine culture. D. Glucose tolerance test. Answer: B. Drug screening requires strict chain of custody documentation to maintain legal integrity of the specimen. A CCMA is measuring an infant's head circumference. Where should the tape be placed? A. Just above the eyebrows and around the occipital bone. B. Around the ears and chin. C. From the nose to the top of the head. D. Under the occipital bone and below the eyebrows. Answer: A. The correct measurement is taken by placing the tape above the eyebrows and around the most prominent part of the occipital bone. Which of the following types of scheduling is used when patients are scheduled at the same time and seen in order of arrival? A. Stream scheduling. B. Open hour scheduling. C. Wave scheduling. D. Modified wave scheduling. Answer, B. Open hour scheduling allows patients to arrive at their convenience and be seen on a first-come, first-served basis. What is the correct action when collecting a capillary specimen? A. Puncture the center of the fingertip. B. Wipe the first drop of blood. C. Use the thumb for collection. D. Squeeze the finger vigorously. Answer, B. The first drop of blood should be wiped away because it may be contaminated with tissue fluid. Which of the following actions is appropriate when administering heparin subcutaneously? A. Aspirate the syringe. B. Massage the injection site. C. Inject into the deltoid muscle. D. Insert at a 45 degrees angle. Answer, D. Subcutaneous injections such as heparin should be given at a 45 degrees angle to the abdomen or thigh, and the site should not be massaged. Which of the following ECG leads is created by placing the electrode to the right of the sternum at the fourth intercostal space? A. V2. B. V1. C. V4. D. V6. Answer, B. Lead V1 is positioned at the fourth intercostal space to the right of the sternum. Which part of the CMS 1500 form should a CCMA check to verify diagnosis codes? A. Block 1. B. Block 12. C. Block 21. D. Block 33. Answer, C. Block 21 of the CMS 1500 form lists the ICD codes used for the patient's diagnosis. When performing venipuncture, which of the following should a CCMA do first? A. Clean the site with an alcohol wipe. B. Insert the needle. C. Tie the tourniquet. D. Identify the patient. Answer, D. Patient identification is the first and most critical step before performing any procedure. Which of the following terms describes the destruction of all microbial life, including spores? A. Sanitization. B. Disinfection. C. Sterilization. D. Antisepsis. Answer, C. Sterilization is the only method that destroys all microbial life, including spores. Which document must be signed before performing an invasive procedure? A. Advance directive. B. Consent to release records. C. Informed consent. D. HIPAA authorization. Answer, C. Informed consent is legally required before performing any invasive procedure. A CCMA is collecting a blood sample and notices swelling at the site. What action should be taken? A. Apply heat to the site. B. Elevate the limb. C. Continue collecting. D. Stop the draw immediately. Answer, D. Swelling could indicate a hematoma or infiltration. The draw should be stopped immediately to prevent complications. Which of the following pieces of information is required on a laboratory requisition? A. Patient's favorite color. B. Patient's insurance copay. C. Specimen source. D. Patient's weight. Answer, C. The specimen source is essential for the lab to accurately process and analyze the specimen. Which abbreviation means before meals? A. QD. B. AC. C. PC. D. BID. Answer, B. AC is the medical abbreviation for antisibum, meaning before meals. A CCMA is preparing to perform a fingerstick on a patient. Which of the following is the best site for collection? A. Index finger. B. Ring finger. C. Thumb. D. Little finger. Answer, B. The ring and middle fingers are preferred for fingersticks because they are less calloused and more vascular. A provider asks a CCMA to administer a subcutaneous injection but does not indicate dosage. What should the CCMA do? A. Estimate based on patient size. B. Administer standard adult dose. C. Ask the patient for dosage. D. Clarify the order with the provider. Answer, D. Never guess medication dosage. The CCMA must verify unclear orders directly with the provider. What is the correct location for lead V6 placement in a 12-lead ECG? A. Midclavicular line, 5th intercostal space. B. Midaxillary line, 5th intercostal space. C. Anterior axillary line, 5th intercostal space. D. Midaxillary line, level with V4 and V5. Answer, D. Lead V6 is placed at the midaxillary line, on the same horizontal level as leads V4 and V5. A CCMA is preparing a patient for a physical exam. Which of the following instructions should be given if the provider will perform a breast exam? A. Lie face down on the table. B. Remain clothed until the provider enters. C. Remove your shirt and bra and sit on the exam table. D. Only unbutton your shirt and leave your bra on. Answer, C. For a breast exam, the patient should remove upper garments and be seated or supine, depending on provider preference.